Hey, did you know Medicare provides mental health coverage? In this video, we're going to dive deep into your options for therapy, counseling, and other mental health services and show you how to get the most from your Medicare health plan. Let's get started. So, mental health is an essential part of overall well-being, yet many seniors are unaware of the comprehensive support Medicare provides. Let's start with the basics. Medicare Part B covers outpatient therapy and counseling services such as individual therapy, group counseling, and even family therapy when it's part of a treatment plan. This means if you're managing anxiety, depression, or other mental health challenges, you can actually receive professional help. For example, consider a senior who has recently lost a loved one. They may be feeling overwhelmed with grief, which can lead to isolation and depression. Medicare can help by covering sessions with a licensed therapist who specializes in bereavement. These sessions provide tools for coping and regaining a sense of normalcy. So a lot of times people hear about life coaching, therapy when it comes to a licensed professional, therapy when it comes to a counselor or personal therapy. And a lot of times it's extremely confusing to understand exactly what you qualify for when it comes to Medicare. My advice to you is to have a conversation with your medical doctor, your primary care doctor, sharing with them your feelings, your emotions, what you're going through, the trauma that you may have experienced, and then what it's causing when it comes to your health. If it's depression, if it's clinical issues, if it's causing a reaction to something that's causing an effect in your health, more than likely your Medicare health plan is going to cover that. The doctor can help give you guidance to a licensed therapist, and or you may have somebody in the family, a friend or an associate that you've worked with that has gone to somebody that they love, and you can reach out to that person and then have your Medicare health plan cover that. So Medicare Part A, on the other hand, is there for more intensive needs. If someone requires psychiatric hospital care, whether for acute crisis or specialized treatment, Medicare Part A covers up to 190 days in a lifetime. This ensures access to the care you need during a critical moment. So depending on what type of Medicare health plan you've chosen will determine your out-of-pocket costs. Medicare Advantage plans have a copay per day up to usually about 5 to 7 days in a psychiatric hospital, where a Medicare supplement would cover the cost if it's medically necessary. Keep in mind that a Medicare supplement is covering the gaps in care that Medicare has, so you pay a premium and it picks up the difference on the expense that Medicare would normally not cover for Part A services, which is the Part A deductible. You know, many people ask, does Medicare cover medications for mental health conditions? And the answer is yes. Medicare Part D helps cover prescription medications for many conditions like depression, anxiety, and even schizophrenia. For example, someone on an antidepressant can receive coverage for the prescription, easing the financial burden. Your primary care doctor will help guide you into the proper medication or medications needed. Plus, getting referred to a licensed therapist is covered by your plan, can be done by your primary care doctor. I often say birds of a feather flock together, so asking your doctor is a simple way to get referred to who they may trust. Asking a friend that has gone through a crisis or need is another optional way to get with a licensed professional that you'll connect well with. So another area where Medicare has expanded is telehealth services. Since the pandemic, telehealth options have become a lifeline for seniors, particularly in rural or undeserved areas. You can now attend therapy sessions virtually, eliminating barriers like transportation or mobility issues. Let's address a few misconceptions. Some people think therapy is only for younger individuals or that Medicare doesn't prioritize mental health. In reality, Medicare recognizes the importance of mental health for all ages and provides services to support seniors living fulfilling lives. Hey guys, so a lot of times we walk through life feeling like we're on this journey and we're all by ourselves and nowhere to go. Sometimes depression, anxiety, frustrations, life piles on top of one another and it begins to build, and all of a sudden we feel this catastrophic weight that's set upon us, and we really can't understand how to walk out of that weight on our own and release things that really sometimes just needs a licensed therapist and someone for you to be able to sit down and talk and create a plan and begin to work out, or what I like to say, creating progress, not perfection. I want to encourage you guys, if this is you and you're going through a struggle right now, do reach out to your primary care doctor. The doctor cares. They want to be able to refer you to a licensed therapist and some help to get you out of that cloud, maybe clear your mind and allow you to be able to make progress. And guys, life is not about perfection. It really is about the progress that we're making. Now, let's talk about how you can access these benefits. Start with your primary care physician. They can assess your needs during your annual wellness visit that you do each year, which includes a depression screening at no additional cost. From there, they can refer you to an in-network provider. Once you've chosen a provider, schedule an initial consultation to really discuss your goals and your concerns. For example, Jane, a senior living with anxiety, connected with a local counselor through Medicare's directory. She scheduled a bi-weekly session and used Part D to cover prescribed medications. With this support, Jane has learned coping strategies that have helped her navigate daily life more confidently. Medicare also supports group therapy, which can be a powerful way to connect with others facing similar challenges. For instance, a group therapy session for seniors experiencing social isolation can foster communities and provide practical tools to build meaningful connection. One challenge seniors often face is understanding the scope of their benefits. Did you know Medicare covers services like alcohol misuse or counseling or smoking cessation programs? These are a part of Medicare's commitment to preventative care, ensuring seniors have access to resources that improve both mental and physical health. Hey guys, if you talk to your grandkids and possibly even your kids, my mom's in her 80s now, and in that generation, smoking was kind of a normal thing back in the day, and now we see that smoking really isn't a normal thing, but often people are still plagued with the addiction of nicotine or maybe the addiction to alcohol, and you may be suffering from an addiction that you're trying to walk out yourself. I would encourage you guys to reach out to your primary care doctor, tell them what's going on in your life, and have them be able to refer you into some of the services that your Medicare health plan provides. It doesn't cost you anything. It provides an outlet for you to be able to communicate with professionals to create a game plan to overcome the addictions that you're facing, that you're wanting to overcome yourself. For those managing chronic conditions like dementia or Alzheimer's, Medicare also supports caregivers through covered family counseling sessions. These sessions offer guidance and strategies to help families navigate the complexity of caregiving while maintaining their own mental health. As we wrap up, remember that accessing these services doesn't have to be complicated. Medicare Hub is here to guide you every step of the way, whether it's finding a provider, understanding your coverage, or answering your questions. We're committed to making Medicare simple for you. Hey guys, to dive deep into your options, join one of our free Medicare Made Simple webinars or attend a live event. These sessions provide an actionable insight and personalized advice to help you maximize your Medicare benefits. Click one of our options in the description below. Thank you for watching, and don't forget to like, share, and subscribe to our channel. Watch more videos to explore Medicare topics in detail. Schedule a call today, and let's make Medicare simple for you.